Good morning. Today we're going to be talking about unlocking your heart health. This is in honor of the World Heart Day, and we're very fortunate to have a very experienced cardiologist with us. Thank you, Dr. Tosin, for coming on the program. It's always a pleasure to have you here with us. Can you tell us about the heart, why the World Heart Day is important?
Thank you very much, Pamela. Once again, a pleasure to be here with you for this very important day of World Heart Day. So to address your first question, the reason why World Heart Day is important is that cardiovascular diseases or heart conditions still remain the #1 killer of people worldwide. Traditionally, it's been thought that it's been noted that the high income countries like the US, Canada, and the UK, the #1 cause of death in these countries has always been heart diseases or cardiovascular diseases. But we now increasingly recognize that heart and cardiovascular disease are now becoming the #1 cause of death in low to middle income countries like Nigeria, due to the increasing prevalence of conditions such as hypertension, diabetes, and raised cholesterol. And why it's important that we mark this day is we need to really spend a lot of time increasing the awareness amongst the general public of the things that can lead to cardiovascular diseases or heart diseases, and the things that they can do to mitigate or to prevent, reduce the risk of developing these diseases, and also make them aware of the kind of symptoms that they may have and what treatments they may require in order to maintain their long-term health.
So can you start from the top then with all those things you've mentioned?
Absolutely. So one of the key things is the first thing we want really people to be aware of is the fact that cardiovascular diseases are pretty much the #1 killer of people in countries like Nigeria. And they need to be aware of the things that can lead to increasing the risk of cardiovascular diseases. The #1 thing that we find in countries like Nigeria is hypertension, or high BP, as people like to call it. There are estimates that show that probably 1 in every 2 adult Nigerians suffers from hypertension. Certainly in my practice, when I see people who have heart attacks, who have strokes, who develop kidney failure, the #1 cause of all these devastating conditions is hypertension or high blood pressure. And so it is very important that anyone listening needs to make sure that they know what their blood pressure is. And if it is not less than 130/80, they need to go and see a doctor who can get them to think about starting treatment to get their blood pressure below this important threshold. Other conditions that are very, very important are diabetes, or sugar, as some people also refer to it. This is increasing in prevalence in our society and also needs to be treated to prevent all the complications I already talked about, like heart attacks, strokes, and kidney failure needing dialysis. High cholesterol, smoking is becoming a very big problem amongst the younger generation, and we need to really educate them about the importance of not indulging in this very dangerous habit in order to, again, reduce the risk of complications. And finally, it's very important for all the listeners to know what their family history is. I think we've done a previous show, Pamela, where we've talked about someone who understood his family history and knew that other people in his family had suffered from complications such as heart attacks, and took the precaution of getting his heart checked and finding that he had been at risk of having a heart attack unbeknownst to him, and underwent treatment to make sure that his risk was much reduced, and he continues to do well, probably about 4 years later at this stage. So these are the important things that we want our listeners to be aware of: hypertension, high cholesterol, diabetes, smoking, and a family history of heart disease are the things we want our listeners to be aware of as increasing their risk of having heart disease or cardiovascular disease.
Oh, talking about unlocking your heart health, what kind of steps, we know the risks, but what kind of steps, or what is the key to unlocking it?
Yeah, so this is really the magic key, the code that we want a lot of our listeners to take away from this very important meeting that we're having this morning. And the key to unlocking your heart health and maintaining a healthy heart is avoiding all those risks that I talked about. Some of them have to do with your diet, and some of them have to do with your lifestyle. In addressing the diet component, first of all, hypertension is largely driven by increasing salt intake. And it's unfortunate that a lot of the things that we eat and a lot of the things that we buy to eat, especially when we're outside the home, are very, very high in salt content. And people need to be aware of what these foods are and to take steps to reduce their exposure to these kinds of foods. Probably the simplest thing that most people can do without having to do too much hard work is to reduce the amount of salt they add to their food generally when they're cooking. They just need to keep the salt content of their meals as low as they can possibly get it. And this reduces the risk of high blood pressure. Maintaining a good, active, healthy lifestyle, daily exercise. This is extremely important at reducing your risk of developing high blood pressure by maintaining good overall vascular health through exercise reduces your risk of developing high blood pressure. A lot of the things that we imbibe in terms of fizzy drinks, for example, contain a lot of sugar. And these increase your risk of developing diabetes, which we talked about as an increasing your risk of having cardiovascular complications and cardiovascular diseases. These are all simple steps that everyone listening can take. It's essentially free to undertake all these steps. And these are very important in reducing your risk. Cholesterol is driven mainly by oils and oily foods. We have a propensity in Nigeria, in all parts of the country, for having fried foods, fried meats, and the cooking stews with a lot of oil, reducing the amount of oils that we use in our meals, reducing the incidence of fried food in our meals, more boiling, more grilling, more healthier meals or meat proteins like fish rather than beef, for example. These are all things that can reduce your cholesterol intake and also thereby decrease your risk of heart disease. So these are just some of the general steps. And again, it's important to emphasize these are largely very low risk, essentially free interventions that anyone listening can take to reduce their risk of cardiovascular diseases.
Now, the truth is that you say this thing, but a lot of people, it has gone in one ear and it has come out the other ear. And they're not listening. Okay, the thing of you guys said, really try next week. But I'm thinking to myself, how does the person, for many people, it's not a big deal. But for some people, it's almost like they're signing their death sentence. Who are those people? How do they meet? And who are the people on the edge right now? Are there any signs, any symptoms that people need to say, hello, you are in trouble. You are on the edge. You need to come back. You need to do something now. Are there tests they should do? How do you know who those critical people are that we need them to be sort of on red alert right now?
Yeah. Fantastic question, Pamela. And I think it's really important. And been quite topical for us actually at the hospital, because we noticed that a lot of people develop symptoms and they don't know what to do with their symptoms. And what they do is they try to self-diagnose themselves as saying, oh, I've got a little bit of chest pain, but I think it's heartburn, or I think it's something else that is not so dangerous, and they think it's okay. And then next thing you know, something devastatingly tragic happens. So what we really want people to understand are what are the symptoms that are indicating to you that you could be developing a problem. The most common one that people talk about is chest pain. Now, when we say that, one of the things I've learned as I've become more experienced is when we say chest pain, people say, no, doctor, it's not a pain. It's not a pain. I say, that's fine. It's a tightness, or it's a pressure, or it's a heaviness. To be honest, it really doesn't matter what label people put on it. If you get something, a feeling in your chest area, it doesn't have to be the left, it doesn't have to be the right, it doesn't have to be the center. You have a feeling in your chest area. Classically, we talk about it radiating to your left arm or possibly to your jaw or to your neck. You can get sweaty with it, you can feel short of breath with it. And you notice this particularly when you exercise, when you go for a walk, you're climbing stairs in your house, and you get that feeling. And when you stop and rest, it goes away. And it wasn't there a month ago, or 2 months ago, or 3 months ago. You should urgently seek the attention of a cardiologist, because the next thing that can happen is something that may be fatal. And I cannot underscore this or emphasize this enough. I had a patient who reached out to me. In fact, it was the daughter of a potential patient who reached out to me just this past week saying her father was having symptoms. She's based out of the country. The father's here in Lagos, and that he needed to come and see me. He was contacted. He delayed, thinking, oh, it's not that bad. It's not a big deal. I'll come, the following week or something like that. As I speak to you today, he is no longer with us. He passed on just over the weekend from a cardiac event, because what he was experiencing required urgent attention. He may have felt that he had time, but unfortunately, time was not on his side. And we hear too many stories, especially here in Lagos, of people slumping either at work or at home or in their car while they're being driven home, or in the church. So many stories. I think everyone has heard these stories all over the place. So really, if a lot of people listening, if you have chest pain, chest tightness, chest pressure, heaviness in the chest, unexplained shortness of breath, palpitations, you feel faint and dizzy, go and see a doctor. It may not be anything fatal, but at least let the doctor reassure you. Don't self-diagnose and say, oh, what I'm feeling must be indigestion, or what I'm feeling just must be, I pulled a muscle. For people who may have come across me before, we had a very interesting patient who we saw a few months ago, I think about 3 months ago. He finished work, he stretched and felt a feeling in his chest late in the evening after work, and thought it might have been a muscular thing, but actually turned out he was having a heart attack. It could have been fatal. Thank goodness he had the presence of mind to come to our hospital at Euracare, and we treated him, and we found that he had a blocked vessel. We stented it for him, and he got better. But this is a patient who, if he had thought this was just muscular and decided to ignore it, he might have gone to bed that next day and not woken up again. He's a young man in his early 40s with a family. It could have been tragic. But just because he took time to just think, let me take that precaution of turning up and getting a medical professional, check it out and make sure it wasn't anything dangerous, he is still alive to this day. And really, if nothing else, I want our members, our listeners, to really take away that message. If you feel any of these worrisome symptoms, turn up to a hospital and get checked out.
And not just any hospital, a heart hospital. Thank you very much.
Absolutely. A heart where they have specialists and equipment to be able to make a diagnosis on time, and also provide you with the correct treatment, such as my hospital, Euracare Multi-specialist Hospital.
Thank you very much. Thank you, Pastor Onyebuchi, for coming on the program. The Kanu Heart Foundation is one that a lot of people know well. We know it well, but we'd like to just hear again why, if you can share with us why Kanu, who Kanu is, and for those who don't know, and why he started the Heart Foundation.
Okay, thank you very much. Kanu Nwankwo, we all know him as a professional. He's a legend now. He's a legend footballer. But we remember in 1996, when as a young boy, he led Nigeria to win the Olympic gold medal in soccer. For the first time, any African country can win the Olympic gold medal. After that medal, the next thing we heard was that this young man has a heart issue. And Nigerians prayed for him. Now, he underwent surgery at Cleveland Hospital in the US. And when he came back, people thought he would no longer play football. But he managed to start his career again after playing for clubs like Ajax, clubs like Inter Milan, and clubs like Arsenal. Then when he came back to football, and he decided that after surviving, he knew how much it cost him to get back on his feet. And he decided to say, okay, how do I pay back? How do I give back to the society that prayed for me? Nigerians prayed for him. So the young man decided to set up the Kanu Heart Foundation. That was exactly in 1999. I personally, I traveled to cover as a journalist. I traveled to France to cover the 1998 World Cup. And it was there he met me. We've been so friends. When I was playing in Abia State, he was still a young footballer. And we met and he asked me if I can come and join the Kanu Heart Foundation so that I'll be able to manage the Kanu Heart Foundation for him. That was how I left my place of work and I joined the foundation in 1999. And the vision was to put back smiles who have had problems. Indigent ones.
Quickly tell us. Yes, if you can tell us some of the successes you've had over the years, just quickly.
He formed the Kanu Heart Foundation and we started operation. And I want to tell you that as of now, we have about 300 patients on the waiting list. 300 heart patients on the waiting list. And we have carried out almost 665 open heart surgeries since we started work. Most of the time, first time we started operating them in Israel. We take them to Israel, then the fee was getting higher. We left Israel, we went to India. From India again, we were taking them to Sudan, Sudan and Nigeria. One thing I have discovered over the years is that we see children who die before their 5th birthday.
Yes.
Some of them do not survive their 5th birthday. I remember a case which had in a Sako local government area.
Mr. Onyebuchi, I want to challenge you.
Yeah.
Because we have good heart hospitals in Nigeria now. We have Euracare, we have First Cardiology, we have Reddington, we have a specialist hospital, the one that is in Ogun State, the professor that came back from the US. Yeah. Why are you not working with our own Nigerian hospitals? Why are you not supporting them?
Good. I love that. I love that question. When we started, we tried to see the possibility of getting in touch with our own Nigerian doctors. That if we believe that if it is done here, it will be cost effective. We will reduce costs. But we discovered that it was not so. It was much. I know all the hospitals you talked about. I know First Cardiology. I know the one in Ogun State. I know, in fact, it was even UNTH Ibadan that helped us organize patients that we took to London. The first 2 patients we operated in London, Okude and Eneton, we operated them in London. The problem is that from what I have seen so far, I've traveled, you discover that in some countries, most of the tertiary institutions, they have cardiac centers. But it is not so in Nigeria. It is not so. What you think that is cheap in Nigeria to perform the surgery of ASD or tetralogy of Fallot, you come here, the Nigerian hospitals will be telling you, go and bring 7 million, go and bring 10 million. But you discover that when we now approach some of these hospitals abroad, some of them ask us, okay, pay $3,000. Then now when you now convert $3,000 to, you know how much you get. The most important thing is, again, they don't meet the expected standard. I tell you that what mattered most for us is the life survivor.
Mr. Onyebuchi, you are not here to run down our Nigerian hospitals, honestly.
I'm not doing that.
You are now. You are saying they are too expensive. They don't have good standard. And it's
No,
not true, because
you
the hospitals we are talking about.
Ask me a question.
Yes.
But let me tell you, I have done surgeries in Nigeria. At Alliance Hospital in Abuja, I've done some surgeries, about 19 open heart surgeries in Alliance Hospital in Abuja. I did some surgery in UNTH Enugu. We brought doctors, about 20 doctors, led by Professor Novik. In 2003, we brought them to Enugu, and we carried out 13 open heart surgeries. 11 people survived, 2 died. That was in Nigeria. So I am not running that. I'm just telling you the kind of things we experience in Nigeria here.
So Pamela,
it's not that we have good doctors.
Responded
no, please.
Pastor Onyebuchi.
I think you need to respond.
Yeah.
I think it's only
Pastor. Good evening, sir. Good evening.
Good evening. Yeah.
Yes, it's nice to have you on the program. So
Thank you very much.
What I would suggest is I understand, and I think there is no denying that, unfortunately, for a long period of time historically, you are quite correct in that Nigeria was not in a position to be able to help some of its most vulnerable citizens. That is absolutely correct. There's no disputing that. But I suspect that I think some of your data is a little bit outdated. And I think if you took the time to reinvestigate what is going on, I think you will be very pleasantly surprised to find a number of things. One is that there are a number of cardiac centers available in the country. Some of them even in the public sector, that are doing good work. I think you will be pleasantly surprised to find that the quality of what we're doing in a lot of the cardiac centers, including at Euracare, I've never met you, we've never spoken, I've never spoken to anybody in the Kanu Heart Foundation. I would be very happy to speak with them, for them to see what we are doing, what we are able to do, to be able to really update the information in terms of what we are able to do and the outcomes that we are achieving. So we completely agree with you. This is not about sentimentality. It is about saving the life. It's about providing the best possible care, and making sure that somebody gets the best outcomes. And we are very confident that our outcomes can match anything that you can get anywhere in the world, whether Israel, whether India, whether Sudan, wherever you want to mention it. We are very comfortable to have our record be put up against theirs and see what they are doing. And in terms of costs, which you also mentioned, yes, we know that Nigeria cannot be the cheapest because we all understand our infrastructural issues that we have. But even at the $3,000 that you talked about for ASD surgery, by the time you include flying the child out of the country in terms of ticket, accommodation, with 1 or 2 people who have to go, I suspect that the pricing is probably equivalent or even cheaper in Nigeria when you compare what it is. And again, a lot of these children who need something simple like ASDs and things like that, these are things that we can treat these days with devices in the cath lab, where we can just close this with a simple device and they don't have to actually have any open heart surgery. And these children can be sent home. Usually when I do them, I've done them here in Lagos. They go home the next day. They don't have to stay in hospital more than 1 day, the next day. So, maybe once this program is over, we can interact and we can hopefully have a dialogue with you, and you can see what is being done today, not what happened 20 years ago or so. What is happening now, update the pricing and the outcome data that you have, and then see whether we are competitive with where you have been sending these children to. Because ultimately, I can tell you that even amongst the people who can generally afford very expensive care, I've not yet met anybody who is not happy to be treated in Nigeria rather than traveling abroad. And I'm talking about people who can afford to be treated in London or be treated in the US. If they are confident that they can be treated in Nigeria, they all prefer to be treated at home.
Thank you very much. For me, I am not denying the fact. I am not denying the fact that Nigerians, I'm not denying the fact that we have good doctors. I was trying to build up from when we started. As I'm talking to you now, the Nizamiya Hospital in Abuja, I have just signed an MOU with them, and to be giving them our patients. We have done that with some other patients. Alliance Hospital in Abuja have operated patients, and other hospitals, even in Lasut. I have done that in Lasut. So I was building up how we started. That was why I was mentioning that But for now, we
It's
are
a good
getting,
thing.
we are interacting with them. We're interacting with them, and some of them are coming to tell us, yes, we can do it now, and that is what we're doing. Why I was
Well,
trying
I
to
think
give you a background, I was trying to give you, because that will be one of the questions I will ask you as a doctor. I remember the case in Edo State. We have in a local government, we discovered 17 patients suffering from the same type of heart problem. 17 for one local government. What we did was I had to write to the Minister for Health to complain, say, look at this issue. Look, we should take it up. Ours is that people will respond and go and operate that person. But now, like, this is an eye opener. You are now also informing us of certain hospitals where we can get these things at cheaper rate and not.
we're talking about excellent quality standards and so on. So what I would like to say, there's a lot of new things happening in Nigeria now. We have a number of our doctors who have come back from the diaspora. They've set up clinics, they've set up hospitals, and it's important. Can you just give us a phone number, or how can people reach you if they want to support you, whether financially or otherwise? How can they reach you at the Kanu Heart Foundation?
Oh, okay. You can reach us with a phone number 080-330-43769. You can also reach us at email info@kanuheartfoundation.ng.com. These are ways you can reach us.
Okay, that's great. Thank you. So, Dr. Tosin Majekodunmi, thank you very much. Euracare,
pleasure as always.
And we would like you just to say the last few words for our listeners.
Yes, so
I know you're also having a special event this week for customers or for clients. Please, can you tell us about
it? So, as I mentioned before, World Heart Day is very important. Cardiovascular or heart diseases are the number one killer of people worldwide, and it's very important people are aware of the symptoms that people get when there's a suspicion that they may be having a heart condition such as chest pain, shortness of breath. Please don't self-diagnose. Go to a hospital and get checked out. If it's your elderly parents or siblings, please, and they're complaining of this kind of thing, don't let them say it's heartburn and start rubbing rub or mentholatum on their chest. Take them to a hospital and let them get properly checked out with an ECG and cardiac enzymes and make sure that they're fine. We're doing some free screening at ShopRite at the Palms Mall in Oniru from Wednesday up until Saturday. Please feel free to go there. We have staff members who will check your blood pressure, help to check your blood sugars, and just see if you are at risk and provide some advice as to simple things that you can do. If you have anybody that's having more serious symptoms, we will be able to escalate their care to our hospital at Euracare Multi-specialist Hospital, where we'll be able to attend to them further. I look forward to seeing anybody who is there at the Palms Mall Oniru on World Heart Day. Thank you very much.
Thank you.
I just want to chip in that for us, we're having a program in Aba where Kanu Heart Foundation World Day celebration, Thursday and Friday, 28th and 29th. We're also having some free medical screening. We're also having a walk, a 6-kilometer walk. Kanu and some celebrities will walk around the town to create awareness. And when people come together, there's also going to be a talk on sustenance of the human heart. These are some of the things we are doing to raise awareness about this issue.
Fantastic.
The World Heart Day. Yeah.
Thank you. Thank you very much.
Thank you.
Thank you for watching. Please like, share, and subscribe for new video updates.